The House, they passed it a long time before anything was ultimately enacted. The Senate had a 60-vote majority for most of the time, until Senator Kennedy died. And then that majority went away. But up until that, this health care reform could have been done without all of that badgering and buying off that took place. But it didn't, because there were a good number of members of Congress, both the House and the Senate, that were hearing from citizens like you. Health care reform, yes. Takeover by the government, no. And so we're here today, after the fact, where government has indeed taken over your health care, starting taxation already, before it's even implemented and the actual bill starts to function in 2013, 2014. 10 years of taxing and 6 years of implementation. Now that's a concern to a lot of people. And we could get into many specifics about why it's a concern. 12 new taxes on the so-called group of people that President Barack Obama said would not receive taxation. Those under $250,000 of income. 12 new taxes to do that. Medicare, over $520 billion cut from Medicare. Over $200 billion cut from Medicare Advantage. Now, most of us deal with common sense on a daily basis, whether we recognize it or not. Sometimes it seems too uncommon anymore. But common sense says if you take $500+ billion away from Medicare, $200+ billion away from Medicare Advantage, which arguably is the only part of Medicare that isn't broke, because it's a private sector component, but you take that away, what happens? There's less dollars to go into meeting Medicare needs. And we're already restricting doctors and have a Medicare fix that we have to pass every year for the past 10 years to come up with the dollars so that Medicare patients can continue to go to their doctors and be covered. That wasn't even the bill. The fix wasn't there in this proposal. So we add that to it. We get another huge hole. Bottom line is, this was a government takeover of health care. Now I'm opposed to it, and I've said very strongly, and you need to know, any filter I have, my filter is that if I'm given the privilege to represent this district again in Congress, I will work my level best to repeal and replace this health care plan. I say repeal. Try the one clap. Just try the one clap. Repeal, and I ought to tell you as well, and you ought to expect someone who stands up here and says, if you elect me, I'll vote to repeal it, that I'd have an alternative. And so let me briefly give that alternative, and then we'll open it up for your responses, your comments, your questions. An alternative that I offered when I was in Congress, sat in committee for over a year. Speaker Pelosi refused to allow it to be brought up in committee. It was never dealt with, it was never debated, and yet it is the basis of the plan that the Republicans offered. Even in the White House summit, they brought it to him, our president, as an alternative to the government takeover of health care, the Obamacare. My plan basically did several things. One, it said that we need to expand and will expand the usage and the flexibility of health savings accounts. Probably a number of you in the room have health savings accounts. They're restricted significantly, so they never can be quite the benefit that you want them to be. If we took the cap off, allowed them to continue to grow, if we allowed flexibility in what they were used for, even to purchase better health care coverage, they're your dollars, specifically to be used for health care and medical issues. Why not let them expand? So we would expand the usefulness of health savings accounts. We would also allow for the first time something that many small businesses have been asking for many years, but that's been fought by big government and proponents of big government, And that's simply associated health plans.